thank you so much for joining us for our physical therapy interview panel. My name is Emily Tadlock. I work for talent acquisition at Northern Light Health.
Many of you are in school awaiting that big interview for your first job in the field. Our physical therapists at Northern Light Health remember just how nerve-wracking that can be and wanted to offer their support. So we'll be asking each of them questions similar to ones that you'll be asked in your interview. Before we get to that,
I'm going to let each of them introduce themselves quickly. Dawn, why don't we start with you?
My name is Dawn Netto. I am the manager of outpatients at Mercy Hospital.
I'm Sandy Myers. I'm the Director of Rehab Services at Inland Hospital.
Heather?
Heather Karen. I am a physical therapist. I'm the Director of Rehabilitation Services at AR Gold Hospital in Bristol.
My name is Ashley Woolley. I'm the Director of Rehab at Sebastopol Valley Hospital.
Great. And Dell?
Hi, I'm Riddell Orth, Director of Rehab at Maine Coast and Blue Hill Hospitals.
My name is Charlotte Jordan. I supervise the physical therapy department at Maine Coast Hospital.
Great. So now we're going to get into some of our interview questions. The first question I'm going to throw right out to Dawn. Dawn, how do you motivate patients and keep them engaged in therapy?
The biggest motivator is just to set goals that the patient also has a part in, and not just setting goals that I think are important to myself. So if you involve the patient in the planning of the treatment plans, I think that it goes a lot farther. Providing the patient and the family with education as to why we want them to do what we do is also very helpful. So I think that's the biggest thing, is just make sure that the patient is involved in their care.
Great. Thank you for that answer, Dawn. Okay, so Sandy, I've got the next question for you. How would your conversation go with a patient who is being non-compliant, either with appointments or with HEP?
When I work with a patient that has trouble with either attending or sticking with their home program, I go back to the goals that we set and the why of why they wanted to be in therapy to begin with. I think it's really important that they keep a focus on why they're there. I also will share with them our time is valuable, their time is valuable. And we do have people waiting to get in for therapy, so it's very important that they remember that. And I also will let them know that they're not going to achieve what they want to achieve if they're not doing their home program or attending therapy. So in a nutshell, that's what I would do.
So Ashley, I'm coming to you next. Have you ever dealt with many diagnoses in which you were unfamiliar? And if so, how do you deal with that?
When I was a new grad, we had kind of briefly gone over some vestibular rehab, but not, never got to work with a real live patient. So when you get into outpatient, I definitely leaned on my my coworkers and how to treat a person effectively. And then once you do it a few times, it's easy, but initially, so that initially in my career, that was one of the diagnoses that I, wasn't confident with. Things now that I don't typically treat are TMJ, so I definitely have some people that I'm like, hey, what do you think about this? So you just rely on each other and work as a team to get the patient the best results that they need to get the job done. So
there's no I in team, so that makes total sense. Thanks, Ashley. Next question, Dell, we're going to come to you, okay? So a patient has unlimited therapy coverage and they want to continue with their therapy, even though they may have already accomplished their goals. So what is your response to that?
That's not something that is infrequent. It happens. And when it does, we have to sit down and have a conversation with that patient and talk to them about the fact that we need to have established goals. We have to have reason and merit behind therapy. And, we're not a gym, we're not a personal trainer. So once we achieve those goals, it's time to be done. It doesn't mean they can't come back. It doesn't mean whether it's a new problem or the same problem, 6 months or a year or 3 years from now. But really just establishing that guided need, that's part of our practice standard, is to let go and also letting them know that we're preparing for that. We don't want anybody to be completely relying on us forever.
I think that's a compassionate answer to have for sure. Charlotte, I'm going to come to you next. A lot of what I'm hearing from many of your answers, communication is key. Give me an example of a time that you were able to successfully communicate with another person, even if that individual may not have personally liked you.
Well, I think there are times when you, with patients, your goals and their goals may be different. Your goals are to get them to mobilize. So a lot of it is trying to continue to get them to work through a situation, even when it's not necessarily what they want to do at that time. They may be irritated because of pain, lack of sleep. And usually I think I established with them, their goal is to go home and to be independent with walking in stairs. So we need to do that despite the pain that they're experiencing. So I guess that's my answer.
So my next question is coming around to you, Sandy. So how do you manage your time and set priorities? And then, obviously you have lots of things coming to you at once. So just how do you handle all that comes at you?
Planning. Different activities take different amounts of time, and as a treating therapist, but also as a leader, you're juggling many balls at one time. And sometimes one ball has to go a little higher than the others. And I think it's just accepting that that's going to happen every day. And I try to use a calendar, and I try to fill that calendar up. I look ahead to know what I have coming the next day. And I try to communicate when I can't meet a need or something pops on my day that is going to interfere with something that's scheduled. And I think that's true as a treating therapist. When I was treating full time, we have these set appointment schedules, and a patient is going to come in and all of a sudden need something a lot different than you thought they were going to need. And I would really have to rely on my team to help out. And I would always be that helper too. If I saw a teammate getting behind, I'd jump in and say, hey, how can I help? I have a few minutes. And I think that's just the reality, especially working in an outpatient arena. I think working on an inpatient arena, you're waiting on other departments sometimes, and that can get a little frustrating. You have to be willing to, pivot at any given time. So knowing what your day is going to be like ahead of time gives you a good start. Early on, I know I would get very panicked at the first part of the day when I saw the schedule. And as I got seasoned and further along, I'd realize, okay, and then I realized, okay, I'm going to give it till noon. The picture is going to look a lot different by noontime. And I was able to translate that to the staff once I became a leader. Don't panic, just get to work. We'll touch base again at noontime, and the picture is always different as you work throughout the day. I think a lot of times it's planning ahead, using your calendars, communicating well, and just accepting that it isn't always going to go according to plan.
Great. Thanks so much for that answer, Sandy. I love it. Got to have a plan. So Heather, I'm coming to you next. Why Northern Light Health? Why be a physical therapist at Northern Light Health?
So I think we have the culture at Northern Light Health that really starts with the leaders, a lot of who are on this call right now. We really are a team, even though we're all at different hospitals. We standardize processes together. We share our resources, and we really value education. And I think that culture is passed along to our employees. And we also have the benefit that we are a not-for-profit organization, so we really can put the patients first and focus on the patients and do all the other things that maybe a private practice doesn't have that luxury. So I think definitely education is a priority, and you see that in the students that we take from local colleges. It's our partnership with each other and the teamwork culture.
All right, this next question is for Del. So can you explain a time when you may have made an error, and then what did you do in that situation?
So I've come to learn over the course of my career that errors happen. But they can be fixed. And I guess we've got to talk a little bit more about the type of error. But if it's documenting on the wrong patient's documentation, you fix it. There's always a way to correct those errors. So you do that. You make that error, accountability in your documentation. If you did something wrong with a patient, you have a conversation with them and say, look, I gave you these exercises and they were wrong, so we've got to fix that. It comes down to being accountable and just not dwelling on the fact that you made a mistake, but you find that way to fix it.
Okay, so now we've gone through quite a few questions. These are types of questions that a lot of you students will be asked. So now I'm just going to go through each individual here and just ask them, what's that one piece of advice you'd have for them getting ready to head into an interview? Dawn, we'll start with you.
One piece that I've learned over the years is you cannot help everyone. Sometimes you do all that you are trained to do as a physical therapist and you still can't get your patient to where you want them to be or to where they want to be. And it's okay. I think it's knowing to reach out to their primary care provider just to discuss the other options other than physical therapy, because sometimes physical therapy is not the answer for them. So I guess that would be my advice.
Great. Sandy?
I would say coming into your interview to really be honest, to really know what it is you're looking for, and to articulate that well. I look for somebody who is teachable, so I want to see that. So come in open and honest about where your skills are at, and no question is a question that is a bad question. So feel free to answer those questions as you come in, and be relaxed.
Great. I like the be relaxed. That sounds good. Heather, you're next.
I think given our market right now, there's lots of PT jobs available out there, and it's important to look for a position where you're comfortable with the staff, where you have mentoring and a group around you that can help you out, because you really can't put a price on that. Having a good team that works beside you is way cheaper than any continuing ed course or those kinds of things. So look for a good group to join.
And you definitely have a great group over there at AR Gould. I've worked with you guys a couple of times. You guys really are a great team. I think that's awesome. Ashley?
I agree with asking questions. I think as new grads, it's easy to just, get asked all the questions and at the end, do you have any questions? Nope. So I think not being afraid to ask questions and find that good fit, and, even ask about shadowing. If you're really interested in the setting, then see about shadowing and experience, interview with multiple clinics to see where is a good fit, and ask those questions about your culture, about your time off requests, your continuing education, just asking what other things as far as the total package in your job, like what can we offer?
No, I think that's a great question. You always get to the end of an interview and they say, do you have any questions? And I always try to come in prepared with one or two that seem pretty simple, but I think those are great suggestions, Ashley. Del?
Don't fear your weaknesses. And we've all got those types of therapy or types of techniques that we want to stay away from because we're scared to death about failing with them. If you embrace those things, you'll grow in those things. And I had a fellow colleague now. He was my roommate in college and absolutely hated neuro. Didn't want anything to do with it. Didn't care if he never saw a neuro patient in his entire career. Now he's at a specialty clinic in Arizona. He's a certified neurospecialist. So embrace those and learn. You're going to be surrounded by other therapists, and every one of them has something new to teach you or something different. So take advantage of that, and really just tackle or attack those things that you don't feel comfortable with, because you're going to get better at it.
Great answer. And Charlotte?
So I would say to a new grad, explore all your options. There's a lot of different fields you can go into with physical therapy. You can go into a skilled setting, you can do acute care, you can do an outpatient setting. And when you start school, you sort of develop a certain path. And for me, I thought I wanted to do outpatients, but I'm actually an acute care PT, and that's all I've done for the last 21 years. And I absolutely love it. But definitely explore your options, and remember that the interview isn't just us interviewing you, it's you interviewing for where you see yourself, and where you feel like you would be a good fit. And I think the way in which you figure that out is by job shadowing, or, not just coming in for the interview, but actually going down and like walking through the clinic or meeting the therapists that are, working in the hospital, and sort of meeting the team, because you'll get a better sense as to whether or not it's a good fit for you. So don't look at it as being one-sided. They're interviewing me for a job, but is this going to be the right fit for me?
I think that's all great advice to give to several students who are getting ready to go through a nerve-wracking process.
We hope the information and advice you heard here today helps you along your career journey. That journey could lead you straight to an interview with one of our panelists at Northern Light Health. We have openings across our system at hospitals and home care and hospice locations across the state of Maine. We'd love to hear from you. Whether you've got questions or you're ready to apply, just reach out.